How can transitional cell carcinoma metastasis be prevented? Imagine catching a small problem early before it spreads and becomes much harder to treat. That's exactly what early detection can do for transitional cell carcinoma, or TCC, which can develop in parts of the kidney like the renal pelvis, the ureter, or the bladder. The key to preventing metastasis, which is when cancer spreads to other parts of the body, is to act promptly and choose the right treatment options based on how advanced the cancer is. The most important step is complete surgical removal of the cancer. For TCC in the kidneys, renal pelvis, or ureter, doctors usually recommend a procedure called a nephroureterectomy. This surgery involves removing the entire kidney, the ureter, and a small part of the bladder where the ureter connects. Removing all of these tissues helps ensure no cancer cells are left behind that could cause the cancer to spread later. Sometimes, if the tumor is small and localized, a less extensive surgery called segmental ureteral resection might be done, but that's only for early-stage tumors. In cases where the cancer has invaded deeper layers or is more advanced, chemotherapy can be very helpful. Chemotherapy drugs like cisplatin-based regimens are often used before surgery, called neoadjuvant therapy, or after surgery, known as adjuvant therapy. These treatments help kill any tiny cancer cells that might have already started to spread but are too small to see on scans. Using chemotherapy in this way has been shown to improve survival and reduce the chance of metastasis. Immunotherapy is another important tool, especially for more advanced or metastatic TCC. This treatment helps the immune system recognize and attack cancer cells. For non-muscle invasive bladder cancer, doctors often use BCG therapy, which is an immunotherapy delivered directly into the bladder. For cancers that have spread beyond the bladder, immune checkpoint inhibitors, given through intravenous infusions, can help control the disease and slow its progression. Regular follow-up is essential because TCC can come back or spread even after treatment. Doctors recommend routine imaging scans, urine tests, and cystoscopy, which is a special camera exam of the bladder. Catching a recurrence early allows for quick treatment, which can prevent metastasis from developing. In some cases, combining different treatments can be effective. For example, in muscle-invasive bladder cancer, a combination of surgery, chemotherapy, and radiation therapy, called trimodality therapy, may be used to control the tumor while preserving the bladder. When cancer is very advanced or recurs after other treatments, removing the bladder entirely, known as a cystectomy, might be necessary. Finally, participating in clinical trials can give patients access to new therapies that are still being studied. These include experimental drugs and novel immunotherapies that aim to improve control over metastasis and extend survival. In summary, preventing the spread of transitional cell carcinoma involves early and complete surgical removal, appropriate use of chemotherapy and immunotherapy, vigilant follow-up, and sometimes combining different treatment approaches. Always remember, each patient is unique, so it's vital to work closely with healthcare professionals to develop a personalized plan based on the specific details of the cancer. If you or someone you know is facing TCC, consulting with a medical team ensures the best strategies are used to prevent metastasis and improve outcomes.